towards preventive medical care as opposed to reactive, from next year, the Health Ministry will be inviting each resident in Singapore to enroll with one GP or polyclinic doctor of their choice for all their care needs. Getting a primary care doctor to lead the care for patients would help prevent diseases as well as reduce or delay the likelihood of those with chronic conditions needing treatments at the hospitals. This is happening as demand from a fast-aging population will inevitably surge, and healthcare expenditure is expected to triple in the coming decade to almost 27 billion in 2030.
The measures must be taken early when the person is still healthy. We must identify the risk factors in our lives that will erode our health slowly and quietly, and then address these factors. It must be done in homes and in the community, not in hospitals or clinics. It is best centered on family doctors in polyclinics and GP clinics, and less on surgeons and specialists in hospitals. However, only 3 in 5 Singaporeans have a regular family doctor. The other 2 tend to doctor hop. Go to Dr. A for hypertension medicine. Go to Dr. B for cough and cold and get MC. So there is no one family doctor who knows our overall health condition and family health history well enough to be able to see the link between different care episodes.
Let's find out more from the Straits Times' senior health correspondent, Joyce Teo. Joyce, I see the same GP whenever I fall ill. How will my visits change with this program?
With this change, you won't be just seeing him when you're ill. So it's kind of like you'll be making regular scheduled visits. Health Minister Ong Ye Kung says that it will be at least once a year. So that allows the doctor to actually assess your overall health condition. So you don't actually go there only when you're sick, right? So he can actually conduct health screenings and then suggest maybe lifestyle changes to help you improve your health. He can even refer you to like a social service agency, or give you an exercise prescription and then get you to join, like, say, a brisk walking program, So it's not like just giving you medicine for an illness.
And something that comes to mind right away, Joyce, is the logistical challenges of implementing this. Are there enough GPs, and how much will this add to their workload?
Right. So, okay, it will take some time for this to happen, right? So people will sign up for it progressively, and the MOH said that it will support the GPs in this. So, for instance, in helping them build up their clinic capabilities in telemedicine, IT systems. It's also going to help build up the workforce in the primary and community care area. So I spoke with Dr. Tan Tze Li. He's the president of the College of Family Physicians in Singapore, and he says that he thinks GPs can do this. Just looking at how the GPs have stepped up to help Singapore fight COVID in this Omicron wave. So it's workable, possible, and MOH said they will support the GPs anyway. There'll be training, there'll be lots of other support as well.
And do you expect the program to result in fewer people going to the hospitals, which are considered to have better facilities and care for non-emergency cases?
If this strategy succeeds, it will result in less people needing to go to the hospital, or just generally less hospital visits. So you only go to the hospital, hopefully, only if you need, like, say, complex treatments. But as for non-emergency cases, many people go there for different reasons. Maybe they're unsure of what to do or who's there to take care of them, right? By making the GPs the focal point in this Singapore's healthcare system, it might just help shift mindset, right? Like if people think that the hospital is the best place for their care needs, which they do now, in the future, it will be your regular GP who will see to all your care needs. And you'll be the one person who actually knows you. You form a relationship with him, and you see him over a period of time. He actually understands you, and he can advise you on things to do to improve your health. Just imagine, walking down to the GP downstairs or near your house to, discuss your health. You don't have to wait a long time at the hospitals. The GPs, I think, will be a lot more accessible, and it's somebody that you know